Hello, everyone. My name is David Amadi, and I'm a data scientist and metadata specialist with London School of Hygiene and Tropical Medicine, and based at African Population and Health Research Center Data Science Program. I regret that I cannot be with you in person today due to some logistical challenges with my travel. However, I'm delighted to share my presentation virtually and contribute to the OHDSI UK third annual meeting. Today, I'll walk you through our work on strengthening data science capabilities in African health institutions, particularly focusing on the adoption of OMOP-CDM. For today's content, we'll look at the introduction, data capability maturity, our implementation journey, the Pathfinder progress and insights, some of the achievements that we had, federated research, key challenges, and also look at OHDSI Africa, which we are part of them, and then lastly, the acknowledgements. For our first slide now, where we shall look into the APHRC research priorities. So the African Population and Health Research Center is African premier research institution addressing pressing challenges in population health and development. It is African-based and African-led with headquarters in Nairobi, Kenya, and a West African region in Dakar, Senegal. Its research programs span in health and well-being, human development, urbanization, data science, and other themes. The data science programs is being led by Dr. Agnes Chiraga, which anchors initiatives as the Data Science Without Borders, which support our goal for building fair, sustainable data ecosystem, with APHRC serving as the coordinating center. The Data Science Without Borders, which we refer as DSWB, is an initiative to break barriers in health and data science across Africa. It bridges data gaps, strengthens local capacity, and fosters collaboration across institutions and countries. The project is implemented in 3 Pathfinder countries, that is Senegal and Cameroon in Francophone West Africa, and Ethiopia in Anglophone East Africa, each with different context and needs. Our focus area includes OMOP-CDM adoption, data utilization for real-world evidence, and AI and ML application in health research, with the ultimate aim of positioning African institutions to lead in global data research. For the first year, which was in the year 2024, we focused on building system and establishing foundations. And our first annual general meeting was held in Dakar. And for year 2 and 3 is dedicated to full implementation. We are now in the final quarter of year 2, where OMOP adoption, capacity building, and platform integration are well underway. We also work with technical partners, and we have Makerere AI Lab in Uganda. London School of Hygiene and Tropical Medicine is also one of them, and OSPO now, and CoData, with APHRC serving as the coordinating center. To understand our readiness, we carried out capability maturity assessment with Pathfinder sites, and we examined key 4 dimensions, which are people, which are looking at the skills, leadership, and data culture. We also looked at processes, which involves governance, workflows, and ethics. And most important, also we looked at infrastructure, tools, and interoperability. And also, lastly, we also looked at partnership, which looks at external collaborations and networks. The assessment used a RedCap-based survey tool, drawing on the Center for Organizational Excellence Data Innovation Maturity Framework. This approach combined qualitative scoring with qualitative feedback to give a balanced picture of capacity. And I would say the rationale was simple: to identify bottlenecks in data use for policy and guide our roadmap for capacity building and system strengthening. So on our findings for the assessment, which revealed 3 key main findings. So the first one is on varying levels of data maturity across institutions. Some were more advanced while others were in the mid stages. When it comes to innovative gaps, with many institutions lacking governance frameworks, technical tools, and ethical oversight systems. And one most important thing that we also realized is there was a strong demand for capacity building, especially in machine learning, data governance, and secure data exchange. So when we mapped to Pathfinder sites, the assessment highlighted different readiness levels. So, for example, the Ethiopian site, which is known as ARI, was predominantly predictive, and Irrisive Senegal, which was more proactive, actively aligning to governance infrastructure and support for multi-disease integration, and for DGH, which was stable, and it was, of course, with the foundational structure in place, but requiring additional support to scale. So these findings basically have been critical in shaping where and how our investment should be directed in order to maximize the impact across the Pathfinder sites. And finally, to our implementation journey of OMOP. So we adopted a four-layered framework, each layer addressing critical dimensions of data readiness. So the first one was standardization, and as we all know, this is just to align diverse data sets to a common model for consistency and comparability across sites. The other one was analytics at access. This is just to enable researchers to query harmonized data efficiently while maintaining appropriate controls. The other one was on metadata and interoperability. Hereby, we're looking at documentation by strengthening documentation. Also, issues of vocabularies feature in here, and data sharing protocols to ensure that the data is and metadata is machine readable, and cross-system integration is available. And lastly, also, we looked at governance and policies, whereby embedding ethical oversight, data protection, institutional approvals that needs to align with both local and global standards. And for the journey itself, we began by mapping 12 priority datasets across the 3 Pathfinder sites. This was followed by in-person OMOP training CDM in Kenya in September to October 2024 using OMOP OHDSI tools. And we convened over 20 data scientists and managers who were trained. They then replicated this knowledge at their institutions, and also remembering by documenting these processes on GitHub and also Zenedo. And through this replication, we established point of contacts, and we call them the POCs at each site. Their work was strengthening technical skills, improving institutional collaboration, and ensuring that the expertise remains embedded locally. These POCs are now serving as the first line of support, and also providing as collaboration nodes, helping us to build a cross-country network of practitioners. And lastly, I think last month we also began working on collaborative federation, and I'll talk about it later on my presentation. So so far, for the progress that we've done is from the 12 data sets identified, 4 have already been ETL'd into OMOP. That's a good progress from our sites, our Pathfinder sites. So for Senegal, which the organization is known as IRISEF, COVID-19 data has been fully ETL'd, while HIV and cancer datasets are being mapped. Mapping is underway. For Cameroon, the DGH respiratory dataset has been ETL'd, and TB mapping is underway. For Ethiopia, ARI, the HIV dataset have been mapped. We're waiting for it to be ETL'd, and also for the ART and lab data also prepared for the ETL process as well. So these studies illustrate both the opportunities of harmonization for multi-country research, and the challenge of scaling across diverse African health systems. Now to federated research, whereby we all know that ministries of health across Africa strongly emphasize on data sovereignty, where patient-level data must remain within national boundaries and comply with emerging data protection acts, which also mirrors the GDPR in Europe. As a result, as a result, traditional models of data sharing, where data sets are centralized or exported, are being replaced by federated research approaches. And on our case, we for federation, we say that data stays at home or at local institutions or country, and queries models travel to the data instead of moving data itself. And only aggregated results are shared, ensuring compliance, but still enabling cross-country analysis. So within Data Science Without Borders, we deployed Data Shield installation at Pathfinder sites, which has client side and the server side. And I know there are several federated approaches that other institutions are using, but we decided to go with the data shield at the moment. And we have also conducted hands-on training programs to upskill the local teams. And we're also developing use cases. And in the moment, we're using HIV data that from the 3 Pathfinder sites. And these will demonstrate how federated approaches can generate actionable insights across across our borders. So apart from implementation of OMOP CDM, in parallel also we are developing platforms, and we have at the moment 2 platforms that we are currently utilizing. So one of it is AutoML platform, which is a no-code environment that enables model building, visualization, and OMOP-based workflows. And the other one is a DASA platform, which is built on microservices architecture and includes several functionalities, which has metadata catalog, which secures data sets and organization and also sharing. We also have a data science workbench, which has also a low-code and no-code platform, which has a no-code and low-code capability for machine learning and analysis. Also, there is AI chatbot for real-time researcher support. And we also have a smart learning environment, which has a personalized training, which we're still building on that. And lastly, there is governance guidance, which provides legal and ethical compliance, which supports legal and ethical compliance. Up to this point, we've focused mainly on the progress and some of the successes across our Pathfinder sites. But as with any large-scale data harmonization initiative, we have faced some important challenges that will continue to shape our work. And first of all is the governance, data access and governance. And this has caused us to have lengthy clearance and approval process, often delaying the ETL timelines. To mitigate this, we are working to strengthen governance framework and streamline approvals and put in place clear oversight mechanism for local data use. The second one, and this I think is one of the major ones that we are working on, is vocabulary gaps and localization. So we've encountered missing African specific terms, particularly in the health and demographic surveillance system context, and some clinical settings, as well as social determinants of health. In addition, many of the OHDSI tools like Usagi are still limited to English, and our response has been to develop some of the interim vocabularies using Jackalope, and also build multilingual local extensions using machine learning and to contextualize OMOP for population health data. The third one is technical infrastructure, and we've seen real challenges with hardware, sometimes software compatibility across Pathfinder sites. And our mitigation strategy here is to rely on standardized environment and cloud-based deployment, ensuring more consistency and when it comes to implementation. The other one is on human capacity, and on human capacity, there still remains a shortage of domain expert in epidemiology, informatics, and population health, data science. To address this, we are investing as Data Science Without Borders in long-term training, mentorship program, and peer-to-peer networks that connect researchers across Africa. And also, we've had finally, we have innovative use cases. This comes up as a challenge, but it's something that we are currently working on. So one of the most exciting challenges has been limited prior capacity to handle environmental health linkages at scale. And here we see opportunity through the GIS extension and use cases such as HIV and climate change and air pollution. And we are not only contributing to OHDSI and it's not only contributing to OHDSI vocabulary for external exposures, but also building tool chains that can integrate environmental and health outcomes. These are the cases that will enable federated also and multi-country analysis that are directly relevant to the African contexts. So while successes are real, there are also challenges that remind us that the journey that we're going through, and we are trying to build sustainable African-led data science ecosystem that requires both innovation and persistence. And I know this is where I wish I was with the audience so that I could be able to receive maybe some advice on how we can maybe improve on our implementation also on our side, and also um, have to share what others have done when it comes to the implementation processes. And I'm also very excited to share that we are preparing for the first OHDSI African Symposium in the year 2025, which will be held in Uganda from 10th to 12th of November. And this will be a milestone for the regional collaboration and capacity building, providing dedicated platform to showcase African-led CDM use cases and highlight how we are adapting and extending issues like vocabulary to fit local contexts. And this symposium will also serve as an opportunity to strengthen cross-continental research networks and advance capacity, ensuring that African institutions are not just participants, but also leaders in global OHDSI community. This gathering is not just for sharing results, but it's about building momentum, deepening collaboration, and shaping the future of OHDSI Africa. So you are all excited, you are all invited to attend this forum. This work is only possible through strong partnership, and at the core is the APHRC, which coordinates this initiative. And together with the LSHTM coordinator, Ospona Makerere AI Lab, which provides technical expertise, and to our Pathfinder institutions, that is RE, DGH, and IRISEF, which are leading in the implementation and capacity building on the ground. And also grateful to Welcome Trust, which are our primary funders, and not forgetting African CDC, which provides regional leadership and alignment with continental health priorities. Lastly, thank you very much for watching this presentation. Although I could not be with you in person, I'm grateful for the opportunity to share this work virtually. I look forward to continued engagement with the OHDSI community and building stronger global collaboration. And for any queries or questions or comments, please do not hesitate to communicate with me through the email address provided at the slide. Thank you very much.